Agoraphobia is something that affects thousands of people across the world. But what exactly is agoraphobia? What are the symptoms and what is the treatment? Guys, welcome to another week's episode of GetPsyched, and like I said, this week we're going to be taking a look at the psychology of agoraphobia. So the first question that we have to ask is, what exactly is agoraphobia? Well, fundamentally it's an anxiety or a fear to an external situation that you feel that you cannot control and cannot escape from. Agoraphobia is often thought of as a condition that people just stay inside their houses, but it's actually much more than just that. People might actively avoid situations where they feel that their anxiety and their fear might be prevalent. Things such as being away from home, being in crowded situations, or even being on public transport. Now, there are a number of key things that have to happen in order for somebody to actually be diagnosed with agoraphobia. The person's fear, first of all, has to be out of proportion with reality, meaning that the fear is accentuated, it's excessive compared to what reality is actually saying. Also, the person has to exhibit fear or anxiety to the fact that they feel like they cannot escape and don't have a safe plan when they're in any kind of situation. Now, a key point to consider here when we're actually thinking about what agoraphobia is that there actually has been found to be a pretty stark correlation between panic attacks and agoraphobia. With agoraphobia, it's common to experience something called anticipatory anxiety. Now, the meaning of this is basically to say being afraid of fear. Now, this is a real issue that people with panic attacks suffer from, and often people with agoraphobia suffer from. Sometimes panic attacks can be induced in people because they start feeling a little sensation or a little pain or something's changed, and that automatically makes them think that they're about to have a panic attack, and things build and escalate, they become short of breath, and eventually they actually do have a panic attack. And this correlates with agoraphobia because what can happen sometimes is when people are out with a safe area, like their house or a familiar setting, they feel like they have no emergency plan to help them if something does go wrong. Now, agoraphobia, as is already probably evident, can be hugely detrimental to people that suffer from it. People can't leave their homes at times. They need others to do things for them, basic things like going shopping, for example. And actually, people can become housebound for years. So we've got a little bit of a general understanding as to what exactly agoraphobia is all about, but who exactly suffers from agoraphobia? What is the population and what kind of people suffer from agoraphobia? Well, 1.7% of the general population suffer and have been diagnosed with agoraphobia. Women are actually twice as likely as men to be diagnosed with agoraphobia, and an onset of agoraphobia is most likely to happen in late adolescence and early adulthood. So, with that being understood, what are some of the symptoms of agoraphobia? Well, the fear of anxiety, as we've already discussed, is a big one. And this stems around, things like being outside your home, being in transport or being in crowded places, for example, or even being in places that you feel would be hard to escape from. And as a result, sometimes, like I said, people become housebound because of the fear of these situations. It's much easier to just stay in a place that they're safe and they feel secure in. People with agoraphobia often avoid all situations in where they think anxiety could be prevalent for them. There's also something to be said about dependence on others when we think about the symptomologies of agoraphobia and that overall feeling of helplessness. So, what actually causes agoraphobia in people? Well, it's a combination of a number of things, really. Things such as life experiences, psychological traits, and genetics. A combination of all of these things can allude a little bit to why people actually experience agoraphobia and can be diagnosed with it. Now, the genetic factor, the genetic makeup being a contributing factor to agoraphobia is something that's really important to understand in this topic. The genetic factor is thought to make up about 61% of the likelihood of whether or not somebody will actually experience agoraphobic tendencies. Now, this means that a huge part of whether or not someone will be agoraphobic or not is based in their genetic makeup. And 61% of that likelihood actually makes agoraphobia one of the biggest genetic influenced phobias in the world to be made up of a genetic factor. There's also something to be said about experiencing a stressful or traumatic life event that can have an influence on somebody being agoraphobic. The death of a loved one, or even things like being attacked or mugged or robbed, for example, can lead to somebody becoming an agoraphobic. So we've had a little bit of an understanding of what agoraphobia is, the kind of people that suffer from agoraphobia, the symptoms, and actually what causes agoraphobia. But what about the treatment for agoraphobia? Well, treatment goals for agoraphobia, basically without saying, is obvious, is there in order for people to function more effectively. And systematic desensitization, or also known as exposure therapy, can be really impactful for people that suffer from agoraphobia. Now, there's a number of ways in which exposure therapy is actually conducted by therapists. Some of the classic examples are things like flooding or progressive exposure. Flooding basically means when, for example, if you're scared of spiders, I'm not saying that your therapist necessarily will do this, but this has happened. If you're scared of spiders, then you're going to immediately hold a tarantula, or you're going to go into a room that's filled with spiders. And the intention for that form of exposure therapy is to kind of get the fear and the anxiety out of your system. Progressive exposure is a little bit different. That's when there's a steady progress of exposure. Again, if we use the spider analogy, maybe the first thing you'll do is you'll look at a picture of a spider, or even before that, you might just talk about spiders with your therapist. It then could build to something like maybe holding a spider, or a spider being in the room, for example. And again, the intent is for you to eventually have your anxiety and fears of spiders to dissipate. And it's very similar for treatment or exposure therapy treatment for those that experience agoraphobia. For example, the person might relax, the therapist might help the client to relax, and then progressively go through the stages of anxiety and fears. The things that they're least afraid of are the things that cause them the least amount of anxiety, and building that up and discussing the things up to the things that cause them the most anxiety and fear. And in addition to this, relaxation techniques and breathing exercises can also be implemented and can be really helpful for those suffering from agoraphobia. It's also to be said that other forms of therapy can be really, really impactful as well. Things like person-centered therapy and cognitive behavioral therapy have shown huge impacts for people that suffer from agoraphobia. Okay guys, thanks so much for watching this week's episode of GetPsyched. Like I said, this week we've been looking at the psychology of agoraphobia. We've been looking at what agoraphobia is, the kind of people that suffer from agoraphobia, why people suffer from agoraphobia, the symptoms, and even the treatments of agoraphobia. I hope you guys have enjoyed this week's video. If you have, then make sure to hit that subscribe button, and you can hit that little bell next to the subscribe button, and you'll get weekly reminders of every time I upload. Thanks so much for watching guys, and hopefully catch you next week.